want to introduce yourself?
Oh, yes. No, you go ahead. Ladies first.
So I'm Dr Carrie McCrea, sports and exercise medicine consultant.
And I'm John Twynham, sports physiotherapist. Yeah.
It's been a lot of years.
It has. I'm not sure who followed who, but I think probably we decided 2013.
Yeah.
We first worked together with Scottish Rugby, with the women's national team.
Yep.
And then just kind of through, not accident, I guess Scotland's a small world, but sort of followed paths. I think you were doing some work with the Institute, really?
Yeah, that's right. So Institute, and then, we obviously worked together there, and then we did our first youth Commonwealth Games together in the Bahamas.
Yes, in 2017. That was a
bonding experience.
A lot of challenge because of the heat. Scotland is the least qualified team to compete in high humidity, hot environments, but that was good.
Yeah.
And I think I joined the Institute in 2015, and you were already doing some work with swimming. And so that's kind of we crossed over, and then you probably followed me into a permanent role in the Institute.
That's it, John.
Yes.
Led the way into, particularly into swimming. We've been doing swimming together for goodness.
10 years.
10 years, yeah.
Yeah.
So
and triathlon as well.
Yes.
So we kind of link over in that side of things. And then I guess on the private side, we've both had our separate private practices, and actually, you've been a huge resource for me in terms of onward referrals or second opinions, imaging. So we already built that relationship. So I think it's quite exciting to bring it under one roof at the Edinburgh Practice.
And I think we're so lucky to be able to work in an environment where we get to work literally next to each other on a daily basis. So being able to bring that and reproduce it in a space like this is awesome. And I'd certainly had the benefit of referring patients to John in other spaces and having the amazing feedback from patient.
Exactly, yes. Yeah. I think we both are excited by the complex problem solving. Yeah. We want to get to the bottom of it. We want to try and solve it. Yeah. Makes it very patient-centred and orientated, and I think that's where the commonality is. Obviously, we get along really well as friends. But professionally, I think we're both motivated by the same things, which I think is really important, and have a very similar philosophy to that kind of holistic approach of not just dealing with the problem, but trying to understand why. And sometimes that requires peeling back more and more layers, and then you getting over the head. So it's great to have, other people to share that, those challenges with.
Yeah. And I think, what we also know is having really good relationships with other professionals is so important. And that's something we've spoken a lot about and we've developed, between us is, like we were saying earlier about the depth of experience in the Edinburgh practice, so being able to actually, again, foster those relationships or with colleagues in other spaces. And I think being able for that patient to know that they're getting access to high level expertise in lots of different ways, that's pretty unique, isn't it? Yeah,
and I guess it's like taking our professional work and relationship and expanding it out to a wider NDT, which is definitely what we get here at the Edinburgh practice, tapping into psychology and psychiatry, and excited to see where those relationships will take us.
Yeah.